Executive Director of High Ridge House, a Christian Science sanctuary for healing and renewal based in New York. We are so pleased today to offer you this special talk on Medicare and advanced healthcare directives, making informed choices. We are really honored to have Leslie Connery, Government Relations Counsel from the Committees and Publication of the Mother Church. Leslie provides support to committees worldwide for their work with lawmakers and government officials around the world. She has a very exciting but also challenging position. Her legal practice background is in healthcare and administrative law. She is probably one of the experts in Medicare that I know of. And so we are really, really excited to have this important resource person for all of us in the field. There will be an opportunity for questions after the talk. You may type in your question in the meantime in the chat box, which is in the lower bar of your computer. And this talk is being recorded and will be available for replay for exactly 1 week through January 21st. It will be available on our website. So without much further ado, I want to welcome Leslie Connery.
Thank you, Maravik, and thank you all so much for choosing to join this call today. I'm so grateful. And I also especially want to thank everyone at High Ridge House for offering this opportunity to the community to learn about Medicare. And before I begin, I need to give a slight disclaimer. And that is that, you know, this talk is intended to provide people with basic information about Medicare, and particularly some issues that affect Christian scientists so that people can make informed choices about whether to sign up or not sign up for Medicare and the various parts of Medicare, but it isn't intended as legal advice. The best source of information and the best thing you can do if you have questions about Medicare, there's really no substitute for speaking with an attorney, an insurance broker, and there are also free counseling services available for Medicare beneficiaries. There's one in each state throughout our country, and one of the resources that you're going to get after this talk is a handout. And the handout serves two purposes. First of all, I don't want anyone to think that they have to go through this presentation taking copious notes about everything I say. Please don't do that. The handout is intended to answer some general questions, to provide some information about issues that you might need to think through in terms of signing up for Medicare. And it will also give you a list of resources, and which includes a website where you can find out how to avail yourself of free counseling services for Medicare beneficiaries in your states. You will get this handout after the talk, and I hope you find it helpful. And it also may respond to some of the questions that we won't have time to go into today. For example, the handout specifically discusses how to sign up for Medicare and what you need to do. And that's something, it's kind of more detailed than we're going to have time to get into today. The other thing I want to say right off the bat is that, you know, those of you who might know me know that I am a huge supporter of Christian Science nursing care. Christian Science nursing care is something that has blessed me. It is truly a healing ministry for the betterment of mankind. I've had two very significant healings throughout my life with the help of Christian Science nurses. And the most important thing I can say, during this talk, you're going to hear a lot about Medicare and what it pays for and doesn't pay for, and financial resources and insurance questions, and thinking all of this stuff through. And it's very important for you to do that. But if you take nothing away from this talk, my message is the following. If you need Christian Science nursing care, get it. And don't worry yourself with how the financial resources are going to be there. This week in the Christian Science Bible lesson, we have the story of Elijah and the brook at Kerith, and how he was fed and nourished. And there are so many stories in the Bible, Moses with the manna falling from heaven and Jesus with the loaves and fishes, that really demonstrate that all of us get exactly what we need when we need it. And God knows what we need even before we ask. And so think of Medicare as a resource. It may be a resource available to help you get the Christian Science nursing care you need, or sometimes to help you get other care you need. But there are other resources available as well. There is the National Fund for Christian Science Nursing. There are foundations throughout the country that help pay for Christian Science nursing care. And it's important. Seek the care, seek the healing, and don't worry about where the manna is going to come from, because I can assure you the manna will come. Now, this talk is in two parts. The first, Maravik and High Ridge have asked me to speak a little bit about advanced healthcare directives. So we're going to do that first. And then after that, we're going to switch to a discussion of Medicare, and we're going to be viewing a PowerPoint presentation for that. So let's talk first about advanced healthcare directives. And it's probably first necessary and a good idea if we define our terms. So what is an advanced healthcare directive? Well, basically what it is the legal document that specifies what kind of healthcare you would like to have if you're ever not legally capable of making your own decisions. And there are, generally speaking, two kinds of advanced healthcare directives. First of all, there is typically, and let me just say, this is a very state-specific issue, because these particular legal documents and the procedures for how to execute them and the documents you have to have vary tremendously by state. And so for that reason, this talk is only going to cover some general considerations and things to think about in obtaining these legal documents. But it's very important that you consult with an attorney in your state to find out what are the state laws and the state specific procedures that you have to follow to execute these documents. So going back to what I was initially saying, there are two types of documents. The first is a power of attorney. And that document is basically what it is what it sounds like. It is a document where you nominate someone to make decisions for you in the event that you're ever legally incapacitated. The other type of document is sometimes referred to as a living will. Once again, there are different names for it depending on the state you're in, but essentially what it does is it's a legal document where you specify in writing the kind of care that you want to have and don't want to have. And you can have both. You can choose to have both of these documents. You can choose to have one. It depends on your particular needs, and that's partially why it's important to talk with an attorney if you're thinking about executing these documents. And I do want to share with you a few considerations, some things that you might want to think about in considering whether you want to make an advanced healthcare directive. And the first of these, you might be thinking about, why should I do this, or why should I have it? Well, there are several reasons. And I think the most important of those is that it's the loving thing to do for our families and for our loved ones, for them to understand what it is that we would want if we're ever legally not able to make our own decisions. And these are not easy conversations to have. I know that both of my parents had advanced healthcare directives, and they sat down and talked with those documents about me and with me and my sister, and about what they wanted and didn't want. And a time did come for both of my parents where we had to actually utilize those documents. And it was so helpful because there weren't questions in my mind and my sister's mind about what this individual would want, or what my parents would have wanted or didn't want, because we already knew, we'd had those conversations. So it's actually a loving thing to do. I think that sometimes some Christian Scientists might have a concern about, well, am I sort of preparing for something bad to happen, or even maybe malpracticing myself if I do this? But, you know, it's just sort of like having home insurance or car insurance or that sort of thing. We certainly, in making these preparations, we're not acknowledging that something bad could happen, but in case something bad happens, we have a plan. And that's what an advanced healthcare plan is. It's basically letting your loved ones know in advance. And of course, it's a conversation where, first of all, you do need to be clear with the individual that you're appointing. If you're appointing a power of attorney, you need to be clear with him or her what the parameters of your decisions are, what kind of care you would want to have and not have. And those can be difficult conversations. But you don't want to be in a position where you appoint someone to make your healthcare decisions, and yet they're not totally clear about what it is that you would want. And I think sometimes too, there can be assumption, well, my daughter would know what I want. But that isn't always the case. So please, if you're thinking about doing this, have the conversation. And part of that conversation should also be where you keep these documents, because the documents won't be effective if no one knows where they are. In fact, one of the things that I recommend when people are thinking about Medicare and about advanced healthcare decisions is that you keep all of this information in a particular place and you let your loved ones know where it is so that they can access it if you're ever unavailable to tell them. So these are just good practices to keep in mind in terms of having these conversations. Now, another thing is that the laws of each jurisdiction, as I mentioned earlier, vary with respect to what kind of information can be obtained in an advance directive and the procedures for executing one and having it be effective. And in some states, you actually can specify in your advanced healthcare directive when you would like it to become effective. But in some other states, it actually does require you to be examined or assessed by, sometimes it's a physician, sometimes it can be a social worker or another type of healthcare professional to determine whether you actually have legal decision-making capacity. And that is the case in some states. And I will say that I would just suggest that, if you're interested in following this process, don't let that be a barrier. In my work with committees on publication around the world, I've had the opportunity to interact with so many government officials, including those who are also health professionals. And there is a receptivity to Christian Science and a willingness to understand people's individual choices and support those choices, and a willingness to sort of follow what an individual receiving healthcare wants. So having these kinds of examinations isn't something that you need to be afraid of. We don't need to assume that, the healthcare professional is going to find something negative or make presumptions because you're a Christian Scientist. In fact, it can be a wonderful opportunity to have really healing and leavening conversations with people, explaining what the practice of Christian Science means to you and how you've demonstrated it throughout the course of your life. So this isn't something to be intimidated by, but you should know that some states do require a physician to examine you, either if you're making an advanced healthcare directive, or if people are concerned that you might not be legally competent and they want a determination so that your advanced directive becomes effective. Once again, you really have to consult the laws of your state to understand what would apply to you. Now, you might be asking, okay, what happens if I don't make an advanced healthcare directive and I need some form of care, or I'm not able to make my own decision? And the short answer to that is that most states have laws that determine an order under which family members and loved ones would make decisions for a person. And they usually say that they have to make a decision in accordance with the individual's practices, wishes, feelings, and interests. And those statutes, if you don't have an advanced healthcare directive and you aren't able to make or communicate a healthcare decision, then typically those laws will govern who make those decisions for you. And typically it starts off with the spouse and goes kind of down the line of immediate family. And if there is no one else, then maybe a friend or loved one may be allowed to do it. So there is a procedure in place, but we may not always want those individuals. We may want to specify someone else to make those decisions. And that's another way in which advanced healthcare directives can be helpful. Another thing that you should know once you execute these legal documents is that they're not something that you just executed and put it away. It's great that you did it, but you do want to reevaluate them from time to time to sort of think about, is this still what I want? Are there changes maybe that I want to make, or do I want to revoke it? You can typically revoke an advanced healthcare decision at any time. So they should be living documents that you revisit from time to time and sort of reassess what your priorities are and how you want your care decisions to be made. One thing now, a lot of you may have investigated advanced healthcare directives in your state, and you may have found a lot of information on the internet. And in fact, there is a lot of information on the internet about how to do this in various states, and it's pretty publicly available. And a lot of that information includes forms that individuals can use. And one caution that I would give you is that, and this is why it's also good to work with an attorney, is that if you executing those forms, they typically are just sort of plain vanilla forms with check boxes and very simple statements. But because Christian Science isn't really well understood by the public, and Christian Science practice and Christian Science nursing aren't really well understood, it is helpful and can be very important if you have in your advanced healthcare directive language that describes your desire for Christian Science care and exactly what that means. So where do you get that language, or are there resources that are available to help you with formulating that language? And the answer is that there's a variety of resources. First of all, there are resources available on many of the websites for Christian Science nursing facilities. I know, for example, that Ardenwood and I believe Chestnut Hill Benevolent Association has good resources. So you're welcome to look at those sites. Another thing is that there is an email address that you can use for, if you're working with an attorney, you can email, and the email address is legalinfo@csps.com. So it's legalinfo@csps.com. And if you send an email to this address saying that you're working on an advanced healthcare directive and you would like to talk with someone about language that describes Christian Science care, this email leads to someone in the office of the General Counsel for the Mother Church, and they can provide you with some template language to use that you might find helpful. They're not going to give legal advice because they're not practicing law in the state that you're in, but they can provide you with language to put in your advanced directive that you may find helpful. One other just final caveat that I'm going to say about advanced healthcare directives is that they don't necessarily govern financial matters. It's different once again in every state, but many states have a separate power of attorney that you would execute to give someone power to make financial decisions for you. And so it's important to know that that's a separate process typically, but it is something that you may want to think through and also speak with an attorney about. I hope that you have appreciated this very general overview of advanced healthcare directives, and then it's been helpful. It's hard to speak sort of in great specifics about this topic because it is so state specific, but hopefully this is just giving you some things to think about. So at this point, what I am going to do is share my screen, and we are going to proceed to talk about Medicare. If I can, that is not what I wanted. Please bear with me here, folks. Okay, here we are. Sorry about that. So we are now going to proceed to our discussion of Medicare, and hopefully this PowerPoint will help inform you about some basic issues that you need to know about Medicare enrollment. There's a lot of really good counseling help out there to talk about Medicare as a general matter. And if you have general questions about how to sign up for Medicare and that sort of thing, the best thing I can do actually is to direct you to the state resources for free Medicare counseling that you'll find on your handout. Those individuals they're certified to provide counseling through a standardized process, and they're excellent at it, and they will give you objective advice about what to do. What this presentation really focuses on is there are some unique issues about Medicare that you may want to think about, in particular if you're a Christian Scientist, and the folks who do general counseling for this program may not know about these issues. So the purpose of what we're going to do here today is to talk in more detail about some of these issues so that you are ready to think them through when it's time for you to sign up for Medicare. Okay. So first of all, I think that everyone knows it went out in the introductory email that Medicare has actually offered a Christian Science nursing facility benefit since 1966. And that benefit actually is referred to in the federal law as, it's a benefit that is sect neutral. So it's referred to in the federal law as the religious non-medical healthcare institution benefit. And that is a long name. We affectionately refer to these facilities as RINKIs, even though that is kind of a silly name. That is the acronym that the federal law gives this benefit, so it's the acronym we use. Let's talk about the basic parts of Medicare for a moment. We're going to talk in greater detail about each of these parts in a moment. So Part A of Medicare, think of it as the institutional or inpatient component of Medicare. And by the way, Parts A and B of Medicare are affectionately known as Original Medicare. This is the Medicare benefit that was initially passed in the Social Security Act in 1965. Medicare Part A covers basically inpatient care. It covers hospital care and skilled nursing facility care, and it's also the part of Medicare that covers care in a RINKI. Part B is mostly concerned with outpatient care, and this would include things like physicians and medical procedures and lab tests, but it also includes some things that Christian Scientists might not think about, such as if you go to the hospital emergency room and you're treated, but you're not admitted to the hospital as an inpatient, typically your emergency room visit would be covered by Part B. A couple of other things, ambulance services are typically covered under Part B, and durable medical equipment. That's stuff like a wheelchair or a stair lift. It's any sort of piece of equipment that you can use over and over to meet your health needs, including equipment that you might use in your home. So that's Parts A and B of Medicare. And now Part C of Medicare is an alternative to Parts A and B, and it actually replaces those parts. So if you sign up for Part C, you basically don't have Original Medicare anymore. You have something called Medicare Advantage. Let me explain what the difference is. Original Medicare is the model that you're probably thinking of, where you go to a healthcare provider and the government pays for your care. With Medicare Part C is where private insurance companies administer the Medicare program on behalf of the federal government. So if you sign up for Medicare Part C, what you have is a contract with one of these managed care companies to administer your Medicare benefits. This contract is typically called an evidence of coverage, and it's typically over 100 pages long. If you're signed up or enrolled for one of these plans, you will get a copy of it every year. And please, please, if you sign up for a Medicare Advantage plan, keep that copy of your evidence of coverage. It is so important because that is the document that explains the benefits to which you are entitled. And it sometimes happens that individuals, there can be questions about coverage if an individual is enrolled in a Medicare Advantage plan. If you're enrolled in a Medicare Advantage plan, you will typically get a card with an enrollment number, and that card is different from your Medicare card. please keep that card and please keep your plan, a copy of your plan, so that if you ever need to go to a healthcare facility, including a Christian Science nursing facility, they will know what kind of coverage you have without questions. Now, there are benefits and disadvantages to Medicare Advantage, and we're going to talk a little bit more about what those are in a moment. Part D is prescription drug coverage. These also are private health plans that are contracted with the federal government. Typically, that's of less interest to Christian Scientists, but we'll say a little bit about it. And finally, if you're signed up for original Medicare, which is Medicare Parts A and B, you have the option of getting something called a Medicare supplement or a Medigap policy. What that is it covers out-of-pocket expenses that you may incur when you receive Medicare covered services. So for example, coinsurance and deductibles are two very common things that wouldn't be covered by Medicare, but might be covered if you have a Medicare supplement or a Medigap policy. And we're going to talk a little bit more further on about, I'll give you more specifics about what those do. So Medicare Part A, as I mentioned, covers inpatient institutional healthcare, hospital, skilled nursing facility, or WINKY care. Most people, it's free, typically because you've worked enough quarters in Social Security to not have to pay a premium for it. There is a way to pay a premium for it if you haven't done that and you're interested in having it. As I mentioned, Christian Science nursing facilities are religious non-medical healthcare institutions under the Medicare law, and care in a WINKY is covered under Part A if certain requirements are met. Just because you're admitted to a Christian Science nursing facility doesn't automatically mean that Medicare will cover your care or that Medicare will cover all of your expenses. And we're going to talk more about what coverage means in this setting in a moment. Medicare Part B, which covers outpatient services as well as ambulance and durable equipment, is something you have to pay a premium for. The premium changes every year, but typically it's about between $130 and $150 a month. One important, now you don't have to have Part B, and in fact, you don't actually have to have any of the parts of Medicare. You can choose whether to enroll or not enroll. However, if you don't enroll during the period of time that you're initially eligible for Medicare, which for most people who are receiving Social Security when they are reached 65 is 3 months before your 65th birthday, your birthday month, and then 3 months after. If you don't enroll during that initial eligibility period and you later change your mind and you want to enroll, you will pay a financial penalty in the form of a higher premium, because Congress really wanted, this is something that is written into the Medicare law. It is something that was done by Congress to incentivize people to sign up for Medicare at the earliest possible time. So you can still sign up. You may have to wait until what's called the annual enrollment period if you didn't sign up during your initial eligibility period, but you can still sign up. You're just going to have to pay a higher premium the longer you wait to sign up. Part B really isn't used in a religious non-medical healthcare institution. Also, there are some health plans that require you to have Part B, and the one that I've seen the most is Tricare, which is a health insurance program for military service members. Most Medigap or Medicare supplement policies, if you buy those, they will require you to have enrolled in Part B. Another thing that we'll talk a little bit more about later is if you're originally enrolled in Medicare in original Medicare and you want to sign up for a Medicare Advantage plan, the Medicare Advantage plan will look at whether you are enrolled in Part B, and if you're not, they will enroll you. And that's important to be aware of, because if you do get enrolled because you join a Medicare Advantage plan, you will end up having to pay the Part B late enrollment penalty. So it's very helpful to know that if you're thinking about joining a Medicare Advantage plan. So let's talk about Medicare Advantage. I've been seeing a lot about it thus far, and once again, these are private managed care plans that have contracted with the federal government to administer Medicare benefits. There are different kinds of Medicare Advantage plans. I've listed sort of the three major categories of them on the screen here. Health maintenance organizations are typically the most restrictive kind of Medicare Advantage plan. That's where you have to use healthcare providers that are within their network. And if you don't, the managed care plan will either deny the claim, or in some instances they will pay, but they will pay only a fraction of what the actual care cost. So HMOs are the most restrictive. There are also preferred provider organizations, PPOs, and PSOs, point of service organizations. Those are typically less restrictive, but if you're thinking of signing up for a Medicare Advantage plan, it is important to investigate what kind of plan it is and what kind of restrictions there may be on the plan. You might be asking, are there, if I want to join a Medicare Advantage plan, are there any Christian Science nursing facilities that are part of networks? And the unfortunate answer is that at the present time, there aren't. Now, that doesn't mean that you can't get payment for care that you receive if you're a Medicare Advantage enrollee. And I'll speak more in a minute about that, but just know that there aren't currently any Christian Science nursing facilities that are in network with any of these plans. As I mentioned, Medicare Advantage is an alternative to Medicare A and B. Now, legally, these Medicare Advantage plans are required to provide all the same benefits as people would get under original Medicare. And in fact, of late, Congress has been trying to incentivize more people to sign up for these plans. So they've actually been allowing Medicare Advantage plans to provide extra benefits. And you probably have heard commercials on television about this. Get extra benefits, sign up for this plan. That is because Medicare Advantage plans are allowed to provide additional benefits apart from what they are required to provide under Part A and Part B. And that may include things like dental, vision, gym memberships is another popular one. These are things that certainly can be very attractive if you're looking to purchase or you're looking to enroll in Medicare and use your coverage for something. Another aspect is that the premiums, deductibles, and coinsurance can differ from those under Parts A and B. Sometimes Medicare Advantage plans have low or no premiums, or the coinsurance is lower, or the deductible is lower than the Part A deductible. These plans can be very low cost. And for this reason, in recent years, they've become more attractive to Medicare eligible people. You know, whether to sign up for a Medicare Advantage plan, as I mentioned before, there are advantages and disadvantages. And the advantage can be a lower cost plan, and it can be getting these additional benefits. But there are also disadvantages that you need to know about if you're thinking through this issue. And one of them is that these plans are exactly what they say they are. They are managed care plans. This means that you have a private health insurance company, and it's typically done, you know, these companies are typically staffed by conventional medical professionals, and they manage patient care. And one of the things that these plans typically require for inpatient care is something called prior authorization or pre-authorization. And this is where the health plan has to approve the stay in advance. And in many instances, they also have to improve a continued stay. You typically, unless it's an emergency, you have to consult the health plan before admission. And as I mentioned, it's very important to retain your plan documents so that you're clear about what your benefits and any procedures that you may need to follow to access those benefits. I do want to say a few things about Medicare Advantage in the context of Christian Science nursing facilities, because this is an issue about which I care deeply and have been working for several years. So I mentioned in the last slide that legally speaking, Medicare Advantage plans are required to provide the same benefits as Medicare Part A and B, and that would include the benefit for Christian Science nursing facilities. Unfortunately, while they're legally required to do this, it has historically been extremely difficult to get these plans to pay. It's an issue that I've been working on for probably about 7 years. And I do have to tell you that we are making progress. It's been gradual and steady progress, but it is progress for which we're extremely grateful. It definitely, if you're going to sign up for one of these plans, know that you may have to really be an advocate for your care and work very closely with Christian Science nursing facility staff and sometimes someone like me to help get the benefits to which you're entitled. I'm hoping that that won't always be the case. It is my most fervent desire that that won't always be the case, because I have had conversations with very many personnel from these health plans that have shown receptivity. I do want to emphasize that it's not so much that there's animosity toward Christian Science nursing facilities. It's that these plans simply don't know what this form of care is. And part of my job is to help educate people and these plans, as well as to work with federal government officials to help them understand what the Christian Science nursing facility is and what Christian Science nursing facilities do. Typically, these plans are used to dealing with plain vanilla claims. They're used to claims in a medical setting. They know what to do in that instance. But typically when you pick up the phone and you ask for prior authorization for a Christian Science nursing facility case, a lot of times you're talking to a very lower level person. It's kind of like calling because you have a problem with your computer and you reach the tech desk and you talk to the first person that picks up the phone and they're reading from a script. They don't know much about the benefit. And one of the things that we're trying to do is to help these folks be more educated about this benefit, to understand what it is and what it isn't. And it's been a really wonderful opportunity to leaven thought about the potential that Christian Science and Christian Science nursing have to heal mankind. But it is important for you to know, if you're thinking about your choice, should I sign up for Original Medicare or Medicare Advantage? Medicare Advantage may be lower cost and there may be some benefits that are very attractive to you. But on the other hand, if you do need nursing facility care, it may be more difficult for you to get payment for that. And while I'm at it, I'm just going to put in my plug for everyone's prayerful support as we work through these issues, just knowing that divine love governs all and that everyone is entitled to and can have a clear and accurate understanding. I know we're just going to continue to see progress as we work on these issues, and it's truly been a privilege and an honor on my part to work on these issues. Talk a little bit about prescription drug coverage. This is typically, again, something for which you have to pay a premium. The premium is usually very low. And this is obviously because it's prescription drugs. This benefit can't be used in a Christian Science nursing facility. One situation that I have seen a lot of Christian scientists fall into, so I definitely want to talk about it here today, is if you are enrolled in Original Medicare and you're looking at Medicare Advantage plans and thinking you might want to change your Medicare enrollment into a Medicare Advantage plan, please ask the question, does this plan include prescription drug coverage? Some Medicare Advantage plans have prescription drug coverage and others do not. If you're not enrolled in prescription drug coverage in a prescription drug plan, but you switch to Medicare Advantage, the Medicare Advantage plan will enroll you, but then they will then impose a late enrollment penalty against you for not having enrolled in Part D. This is because there's a late enrollment penalty for Part D that works similarly, but not exactly like the late enrollment penalty for Part B. Now, in most instances, it is possible. Medicare Advantage plans, what's available to you will vary by state. In most instances, it is possible to find a Medicare Advantage plan that doesn't have prescription drug coverage, and that can really solve the problem. But it's very important to ask this question. Let's talk a little bit about Medigap or Medicare supplement policies. So these policies, first of all, they're only available for people if you have original Medicare, and typically they do require enrollment in Parts A and B. As I mentioned, they don't apply to people. You can't sign up, you can't have Medicare Advantage and a Medigap policy at the same time. They typically, as I mentioned earlier, cover out-of-pocket costs like deductibles and coinsurance for services that are otherwise covered by Medicare. And typically what happens is Medicare will pay for whatever care is covered, and then the claim gets sent to the Medicare supplement and they pay the balance. They pay the coinsurance or the deductible or in some instances, the extra costs that aren't paid for by Medicare. But they typically require proof that Medicare has paid before they will pay. They may sometimes also include additional days of coverage. These plans are standardized. They actually, and unfortunately, they're named by letters of the alphabet, which can make it very confusing. But if you go to the Medicare.gov website, there's a little chart that you can access that shows what the standardized options are for they have different kinds of coverage by alphabet letter, and you can go and look at that chart and see if any of those kinds of coverage would fit your needs. But one thing to know is that although the benefits are standardized, the premiums are not. So different companies offer different Medigap plans with different premiums depending on where you live. And the best source of information for that I have found is to call the state health benefits counselors, or email the website that I'm going to provide to you on my handout. Those folks are very good at knowing what Medigap or Medicare supplement policies are available in their states and directing people to those policies. One thing though that is always the case is that these policies will be cheaper if you sign up for them at the time that you are initially eligible for Medicare. And that's because the federal law prohibits these companies from applying certain rules that typically increase premiums at the time that people are Medicare eligible. So the best time to sign up for these plans is when you're first eligible for Medicare. You're going to get the lowest rate when you do that. One thing also is if you switch into a Medicare Advantage plan, be aware that you're going to have to drop any Medigap coverage you have, your Medigap policy, because you can't keep both at the same time. And if you ever want to go back to original Medicare and have a Medigap policy again, you're going to have to reapply for that. And this time, though, you won't have those rules applied to you, so your premium may end up being more expensive. Just a quick review of services that aren't covered under Medicare, and I think that this is probably things that most people are aware of. Christian Science practitioner care is not covered under Medicare. That was a decision that was made by the church a very long time ago when the Social Security Act first passed, and it really relates to constitutional considerations surrounding payment for prayer and First Amendment concerns. Cosmetic surgery isn't covered. Vision and dental are not covered under original care, Medicare. They may be covered under a Medicare Advantage plan. And finally, long-term care, or what's sometimes called custodial care. And let me just say that custodial care isn't covered by Medicare at all. It is covered by Medicaid, which is a separate program that's administered by the states for people who are lower income. And it's a means tested program, which means you have to have a certain amount or lack a certain amount of income actually to qualify for Medicaid. And most people who are in sort of conventional nursing homes are receiving payment for their stays and for their residence in those facilities under Medicaid. And it's important. Now, what is custodial care? Well, Medicare was really intended to help people with serious health problems. So if someone is just sort of in a nursing home, for example, because they can't live anymore safely in the community, and they're not receiving health care, and the expectation is that they're just going to continue to reside in the facility, that's custodial care, and that isn't something for which Medicare pays. And that is just, it's important to understand. I'm not going to go into the differences between Medicare and Medicaid during this talk. There's a lot of them. I will mention briefly, there's a lot of Medicare enrollment periods. There's good explanations of this available online, but I will mention just briefly the different enrollment periods that sort of confront you when you sign up for Medicare. First of all is the initial enrollment period, and that's the one that I've been talking about, that begins 3 months prior to your 65th birthday if you're receiving Social Security when you retire. There is the annual election period. That is what we just went through. And basically that is where anyone enrolled in Medicare can make a decision to change their benefits, and they can do anything they want. They can switch from original Medicare to a Medicare Advantage plan or switch back. You can make any changes that you want to your Medicare benefits during the annual election period. There's also the general enrollment period, and that's between January and end of March. That is for people who didn't enroll in Medicare when they became initially eligible, but they have decided they want to enroll. They have to wait until this period if they want to enroll. There is also something called the Medicare Advantage disenrollment period, and that's roughly the same amount of time as the general enrollment period. It ends actually in mid-February. And that is the only thing you can do during that period. If you signed up for a Medicare Advantage plan and you decided that, no, I don't want this coverage, I want to switch back to an original Medicare, you can switch out of that Medicare Advantage plan and into original Medicare during that time. Finally, there are special enrollment periods, and these are really specific to the individual, but that's where the government grants you the ability to enroll or change your benefits because you did something, or there's a special circumstance affecting your Medicare benefits, such as if you're a member of a Medicare Advantage plan and you move outside the service area of the plan, you can change your Medicare benefits to enroll in a new plan or sign up for original Medicare. Let's talk briefly about Medicare benefits and how it works in a Christian Science nursing care, in a Christian Science nursing facility. And one thing I do want to point out is that, you know, there has been an accommodation for this kind of care in the law since 1965. And basically what that accommodation is it's an accommodation from having to have a medical diagnosis. Most Medicare beneficiaries, when they get care, the care has to be medically necessary, which typically means you have to have a physician diagnosis. That is not the case for getting care in a Christian Science nursing facility. However, the Christian Science nursing facility does have to determine that you need what's called a Medicare covered level of care. And they do have to keep a record of that because the government, you know, being the steward of all of our taxpayer money, needs to have evidence that the care was provided to someone who was actually needed the service and was covered by Medicare. So for Medicare to cover care in a Christian Science nursing facility, the patient has to first have a condition that would qualify him or her for inpatient care in a hospital or a skilled nursing facility. And that is something that is directly written in the Medicare law. And then the other thing they have to do is sign an election form, which then is filed with Medicare, and it demonstrates the patient's choice that, yes, I affirmatively am choosing this care or this what's called a religious non-medical healthcare institution benefit for my healthcare. So how are coverage determinations made in a RINCI or a religious non-medical healthcare institution? As I mentioned, there isn't a medical diagnosis required. And using guidelines, the way that it's typically done is that using guidelines from Medicare, every Christian Science nursing facility that participates in Medicare has a body basically called a utilization review committee. And in most facilities, it's the director of Christian Science nursing, the executive director of the facility, and sometimes staff or others that are part of this committee. And they look at the criteria for Medicare coverage. What is the patient's condition? What care needs does this person have? and determine if the individual qualifies for Medicare coverage. Now, I spoke about the election form, and the religious non-medical healthcare institution benefit, as I mentioned, is something that patients have to elect. And the reason is, it's important for everyone to know that when this benefit was passed, there was a lot of concern going on in Congress about Medicare fraud, waste, and abuse. And so Congress wanted to be reassured, basically, that there wouldn't be people switching back and forth between conventional Medicare, conventional medical care and religious non-medical healthcare institution care. So for that instance, they put in place, and this is also in the statute, a rule that has to do with elections and when you revoke your election. And as I say in the PowerPoint, revocation happens when a RINKI patient voluntarily receives medical care, which is defined by regulation as any care that's given under order of a physician. And so if you sign an election form and go to a Christian Science nursing facility and your care is Medicare covered, then if you receive involuntary care, let's say that you have to receive treatment for a contagious disease because there are concerns about the public, or you're taken to a hospital in an ambulance because you're unconscious, that's not voluntary care. So that doesn't apply to this particular rule. But if you sign an election form and you voluntarily choose to receive medical care, if you do it once, then you can go back to the Christian Science nursing facility and have Christian Science nursing care again with no waiting period. You can just go in, you'll be asked to sign a new election form, and your Medicare payment, if the care is covered, will continue uninterrupted. However, if you do it twice, there is a year waiting period. So if it's your second revocation, you have to wait a year before you can access this benefit again. And if you do it 3 times, there is a 5-year waiting period. Now, you know, this is, like I said, this part of the law was really put in place. It was intended to protect the Medicare Trust Fund from a perceived concern about fraud, waste, and abuse, and people switching back and forth. And whether we like it or don't like it, this is what the law is at this point. And as I mentioned before, revocation occurs if you do revoke the benefit by voluntarily receiving medical care. You will need to sign a new election form if you need RINKI care and you're admitted to a facility. This is the part of the presentation where I feel like I'm teaching a college calculus word problem class, but I have found that the best way to explain how revocation works is to actually use some examples. So I'm going to try to do that. So in our first example, you have a patient that is admitted to a RINKI and they need a Medicare covered level of care, but they just go as an outpatient to the hospital for an X-ray. And they decide they're going to do this. They're not taken there again involuntarily. And then they go back to the RINKI. Well, when they go back to the RINKI, they'll have to sign a new election form, and that is considered revocation, but they can still receive the Christian Science nursing facility benefit because that's the first revocation. Let's compare that example to our second example. This example involves a gentleman who was discharged from a Medicare covered stay in a RINKI, and Medicare ends up paying for a wheelchair to use at home. He then falls at home and is readmitted to the Christian Science nursing facility, but while there decides to go to the hospital for an X-ray. So the first revocation happened when Medicare pays for the wheelchair. The second revocation happened when the person decides to go to the hospital for an X-ray. So at that point, Mr. C would have to wait a year waiting period from the date of revocation. I do want to make a specific mention of durable medical equipment. The way the revocation rules work, they revoke the RINKI benefit if Medicare pays for the care. So if you pay out of pocket for something, or maybe you use a wheelchair that's provided for someone. I know that when my dad was ill, he used a shower chair and some other things that were provided from his town sort of senior services organization for free. It may be worth, if you're concerned about this issue, it may be worth thinking through, are there other options that could help you get the equipment that you need without having to bill Medicare for it? Well, I'm sorry that we have only 5 minutes left in this presentation, but I told everyone there's one additional thing that I really do want to mention because I think it's important, and I'm actually going to try to go back to my slide to mention it, because one issue that does sometimes come up in the context of Christian Science nursing facilities and Medicare coverage determinations is that sometimes a facility, so Christian Science nursing facilities, in looking at Medicare coverage, are required to determine what level of patient the care needs. And sometimes the patient has improved, and that means that Medicare no longer covers the care. Now, that should not be a bad thing. It should be a good thing. It means that there is progress and healing going on. It means that, that someone is experiencing a return to health. And I sometimes have heard folks that, get frustrated when Medicare says, well, this person no longer needs a level of care. But as Christian Scientists, we really should be rejoicing in the healing and not feeling that way. And recognizing that, when someone is removed from Medicare level coverage, that's a good thing. And it's something that we should rejoice over. And as I mentioned at the beginning of this talk, there will be whatever manna you need that is provided to receive the wonderful ministry that is Christian Science nursing will be available to you in just the right amount and exactly when you need it. At this point, I am going to open this up for questions, and Maravik, I know, has been, and others have been monitoring the chat box. I do want to say one final thing, which is that I know that many Christian Scientists have different views about Medicare. And the thing that I have always truly appreciated about our church is that every member is able to make his or her own decisions about his or her health needs, and based on his or her spiritual discernment and individual situation. We're all in our own individual circumstance. For some people, enrollment in Part B will make sense. For some people, it may not make sense. Some people don't want to enroll in Medicare, some people do. But, it's wonderful that we live in a country where we can make these decisions, and that we all belong to a church that we can make, that allows us to make those decisions and doesn't tell us what to do. And we can all support our brothers and sisters as we walk along the road of spiritual progress together. And so at this point, I just want to open this talk up for questions from the audience. And I will tell you, I will stay as long as you want me to stay. And I'm gonna turn my screen share off so that anyone who wants to see the video can, or maybe even put their camera on, can do that.
First of all, thank you so much, Leslie. I've gotten lots of reactions and comments how wonderful this webinar is. And the very first question actually is, thank you for hosting such an important meeting / topic. I have a friend, I believe you may have answered this, but it bears repeating. I have a friend who has no health insurance and is wondering what to do to get signed up for Medicare. I don't think she's yet 65, and I don't know if that matters. Thanks for your help.
Okay. So some of the answers for this you will find on the handout that you're going to get after this talk, because what that handout has is it has links to where you can go, or phone numbers that you can call to sign up for either original Medicare, or if it's a Medicare Advantage plan that you want, or Part D. If you're signing up for original Medicare, you're dealing with the Social Security Administration due to some historical weirdness that I won't go into. Social Security has always handled eligibility issues and enrollment for Medicare. If you're signing up for a Medicare Advantage plan or a Part D plan, you will need to sign up with the plan itself. And typically the easiest way to do that is online, but you'll find more information about that in the resources. And I hope that whoever asked that question, I hope that you're welcome to share the handout with your friend and explain to him or her about enrollment.
We will post that handout together with a recording of the talk on our website, highridgehouse.org. And many of you already have that because that's the reason why you're on the call. The second question is a very interesting one. Are you familiar with 5 Wishes document and any thoughts you might have about it? That's actually from Lynn Meyerson of Clearview.
Okay, so the answer that I have is vaguely. I am vaguely familiar with that document, and I think that it can be sort of a helpful guide in terms of thinking through these issues. But I know that it's available on the internet. It's been widely circulated. I hope I'm not getting it wrong, but I also am aware that there's just a huge amount of variation in different state laws in which in terms of what you have to do, the kinds of documents you have to have and what you have to do to execute them and when they become effective. And so for that reason, while a document like that there are some really good online resources that will help you sort of think through this process, but I really do recommend consulting with an attorney who's licensed to practice law in your state, because they can give you the best guidance and make sure that you won't have any issues with your documents. Great,
thank you. Okay, the next question is, comment actually, which I love. This is from Dennis Collette. I have read that emergency responders look in your freezer for pink papers with your advanced directive info. I have mine in a Ziploc bag in the freezer.
I have never heard about the freezer, but I have definitely heard about, they typically do make an attempt to find, or if there are family around, they will ask the family. It is really important to have your advanced healthcare documents in a place where people can easily find them. But I never thought about putting them in the freezer. That's really creative.
Leslie, I did hear that at another workshop in Florida. I was told that was very common in Florida by healthcare.
Maybe because it's really hot in Florida. I don't know.
Okay. There is another question. I have a relative whose recliner was covered by Medicare. Is this still available these days?
It depends on what the person's needs are. So a recliner would be typically considered durable medical equipment. Right. Another thing that sometimes in some Christian Science nurses, if Christian Science nurses that are on this call may have heard the term Jerry chair, that's another thing, that's another name by which that type of thing is called. Hospital beds in the home are also sometimes covered. The short answer is that it depends on the individual's circumstance and why they need it and that sort of thing. But those things can sometimes be covered by Medicare.
So would you need a letter from a doctor or social worker verifying that?
My understanding is that it depends on the state and it depends on the circumstance. It depends on whether what Medicare would require. I'll tell you, I have heard of instances where a physician's order was required, and I have heard of instances where it wasn't. Okay. I also want to ask those, I've heard that some Christian Science nursing facilities have durable medical equipment that they sometimes will loan to people, and is that something that happens?
Yes, we do that at High Ridge House, and we do have a equipment loan system. And I know that a lot of other facilities have that as well. The next question is, does the Medicare supplement cover extended stay in a rinky?
Okay, so Medicare supplements, which once again, repeating myself, only apply for people who have original Medicare. The short answer to that is that typically there hasn't been a problem with getting Medicare supplements to pay. And sometimes, depending on the supplement you have, they can pay for additional days of coverage in a rinky, or a hospital for that matter. It depends on the kind of supplement plan that you have. But original Medicare, there typically has not been a problem getting payment from original Medicare for stays in a rinky. The Medicare Advantage plans have been challenging, but original Medicare has not. And it's similarly not been challenging to get Medicare supplements to pay.
Wonderful, thank you. Okay, from Susie Heinrichs, if someone is receiving long-term care payments to pay for their care at a CS facility, is Medicare paying the facility as well?
I am a little bit confused by the question, but my guess is if they're receiving long-term care payments, then probably not, because Medicare doesn't pay for custodial care. I am aware that there are some states that, in addition to long-term care, will also pay for higher levels of care as part of their Medicaid program. It could be a circumstance like that. Right now, I don't think we have any Christian Science nursing facilities that are actively participating in Medicaid, but if it's a long-term care situation, Medicare typically would not be paying for that.
Okay. I believe most of the other things, oh, here we go. I understand addressing or a mobility challenge may not qualify for Medicare coverage. Can you please explain a little how it has changed in the last decade? This is from Tim McCutcheon from the Dallas area.
I am, and I think Tim is a Christian Science nurse, actually, and that's a question that I don't feel qualified to answer because I'm not a Christian Science nurse. And I don't think I could, to me, whether something is covered by Medicare depends on the particular facts and circumstances of the case. That having been said, Tim, I know you, and you have my number, and you can call me if you want to talk more about that question.
The other thing I would suggest, Tim, is all the facilities have URC Medicare guidelines that the Rinkies have developed over time. So that can be something that you could look into. And the Leaves, Susie West, who's also the business manager for High Ridge House and the Leaves, she's on this call, so she's a very good resource person for that. Okay, from Beverly Coyle, I hold Medicare Part A and B and a Medicare Advantage. Am I overlapping coverage as my premiums are high? Would you talk about IRMA?
I don't know. I guess my question would be, and one thing that I sort of forgot to mention prior to this call is that there may be circumstances where some of you have individual questions about your particular situation. And if this presentation were in person, I would certainly be willing to meet with you and stay after and talk about those situations. Mm-hmm. So if you have, in this particular case, it might be better for me to talk with you because I can't quite understand how you could have a Medicare Advantage plan and Part A and B at the same time. That just isn't. The fact that you're saying the premium is high makes me wonder whether it's maybe a Medicare supplement, because sometimes those do have high premiums. But I guess maybe we should be in touch after this talk, and I can talk with you in more detail about what your circumstances are. And I would say that if any of you do want to speak with me about individual questions that you have that are pertinent to your particular situation, please contact High Ridge and ask them to put you in touch with me, and we can find a time to talk and work that out, and hopefully I can respond to your questions.
Right. Okay, I have mostly all just wonderful praises. Great webinar. Thank you so much, Leslie and High Ridge House. That's from Geneva Toller, CEO of the BA. Our webinar is very clear and helpful. Appreciate everyone's efforts to help us understand Medicare. That's from Connie Pierce. Oh, I don't want to neglect that to mention the Christian Science Provider Network. Jane Warmack and Connie Pierce are wonderful resource people that help the facilities file for claims for any of this kind of entrenched issues, very difficult or challenging claims that facilities are dealing with.
I have to give a shout out to the provider network as well, because they've been tremendously helpful in partnering, in working with us to sort of help Medicare Advantage plans understand what this kind of care is. And it can be very challenging work. So thank you so much to the provider network.
Yes, thank you so much. And if you want to know more about the provider network, please reach out to us, or just you can do a search and you can easily find that information. Thank you, Leslie and High Ridge House. Very informative and so helpful. Okay, there is okay, just one second. This was fabulous, so helpful and clear. Thank you, Leslie. Very helpful presentation. Thank you for this webinar. I do have one more last minute question, and it's sort of partly comment. It's basically related to Medicare Advantage. I've been told by CS friends that not to sign up ever for Medicare Advantage. So is that true?
Well, I'm not gonna, I really don't feel like it's right to tell individual Christian Scientists what to do, because everybody's circumstance is different. And for some people, I mean, I'm not gonna sit here and say there are no advantages to being a part of a Medicare Advantage plan, because a lot of times they do cost less, and a lot of times they do provide additional benefits. But if knowing that, it's also important for people that this talk is all about making informed decisions. And if you're going to do it, you should know if you need care in a Christian Science nursing facility, it may be more difficult to get Medicare to pay. And to me, it's important that all of you as Christian Scientists have the information. And we're all praying, none of us have ascended like Jesus. We're all here still trying to figure things out. And all of us needs to take this information and really pray about where we are and listen for what God is telling us to do under the circumstances. And as far as I'm concerned, if people are making informed decisions, and I'm not going to tell them do this or don't do that, because they're listening to God and are doing what's right for them on their spiritual journey.
And as Leslie said, this is a roadmap to Medicare, and we are all sort of in this spiritual journey together. You have Christian Science nursing facilities in each of your communities. Please rely on them as your resource center for any of these different questions. There are Christian Science nursing facilities that have withdrawn from Medicare. If you attended one of our other presentations a couple of months ago, High Ridge House is working on planning to withdraw from Medicare. We are still accepting Medicare patients at this time. It's been a very long decision that we've entered into, and we're working that through. But as Leslie actually mentioned, the issue is not to be worried about how your care will be covered, because she mentioned National Fund for Christian Science Nursing, High Oaks, but each of the facilities also have their own benevolence program. So I just don't want to have that be forgotten, because that is available. The facilities all work hard to raise the funds. Many of you, I'm sure, donate towards those funds in your communities. And so that is available for all of us. We are here to serve the community, whether they want to rely. Sometimes our fellow Christian Scientists, we've had a workshop called Nursing Ourselves, Nursing Our Churches, and Nursing the World. We've had to help some of our fellow Christian Scientists help navigate the medical and then take them out of the hospital to bring them to High Ridge House. So that's something that we have been doing for a long time. I myself have been involved in bringing people from the hospital. And so that's something that, we are committed to doing what is really possible, necessary, and available for all of us so that we can be of service to you. We are here to provide that level of nursing care and practical care, and also informational care, because information is, like her talk says, making informed choices. So this is the main purpose for this meeting today, and I hope that you all have gained a lot, and please reach out to us for the future. Our website and our phone number is available on our website. Many of you already are in touch with High Rich House, but there's a lot of new friends on this call. We had quite a huge reception of people. So I want to thank each one of you for making time to really understand the difficult and sometimes really complicated roadmap to Medicare. And Leslie always makes it so clear, excellent, so easy to understand. So let's just give her a big round of applause. And you could also do this if you're muted. And Leslie, thank you very, very much. And thank you to each one of you. And please feel free to contact us.
Thank you all so much.
All right.
Can I?
Love to everyone. I also want to put a plug in our entire Board of Trustees on this call. So thank you to our High Rich House Board of Trustees for supporting us and metaphysically and practically for this workshop. Thanks, everyone.
Thank you.
Thank you.
Thank you. Very good.
Oh, do you know if the facility? Okay, the facility in Princeton does not take Medicare, and that's 10 acre. That was a question just now posted. All right, if you have more questions, feel free to call me. Thank you, everyone, and much love. Bye-bye.
Thank you. Bye.
Bye.